My 19-year-old pregnant daughter, Samantha, is on a path to destroy herself and her baby. Samantha has type 1 diabetes. She had a one-night stand and now she's pregnant. Because Samantha has not cared for herself, we are in fear that this baby is going to be born with severe disabilities.
Are you thinking about who's going to raise this child? Because guess who's going to get stuck with it?
She eats whatever she wants and she doesn't take her insulin regularly. Samantha has slept with more men than I have, and I'm 50. She's been online talking to men since she was 10 years old. Samantha's baby daddy is 14 years older than she is. She's 19, and baby daddy is 33.
You have no clue what you're about to face in the next 3 months.
Sam takes zero responsibility. She failed the 11th grade, quit high school. I work 7 days a week to make sure I have the money to pay for her insulin, food that she needs. I'm her chauffeur. I'm her cook. I'm her housekeeper.
Do you pay now to live with me?
No. I need to save up money somehow for a child that's on the way that I can't afford.
That you should never have gotten pregnant with.
When I found out that she was pregnant 6 months ago, she had to go. I told her, get out. The endocrinologist has told Samantha that she's got the highest risk of death within the next 6 months because the baby takes so much out of her. When Samantha's sugars go over 300-400, it's almost like she's drunk. If I've had a couple glasses of wine, it's like two drunks fighting in a bar. She is 100% in denial. Samantha is not going to be able to take care of this child. If Samantha and this baby survive, then I'm going to be stuck raising this baby. I will not raise this child.
Okay, Christina, I'm glad you're here.
Thank you.
Because you're in a situation that is complex. It is very layered, and this is something that could end up with a child being seriously impaired or dead, and the mother of that child being dead as well.
They could both die, yes.
And I know I hear you say it, but have you really embraced the gravity of what that really means?
I have embraced the gravity. I have embraced the gravity over my daughter's possible death for the last 10 years with everything that I have been through with her, all the ICU visits, all the doctor's visits, all the debriding of her legs, all the neuropathy, but now adding a baby to it. My daughter is a juvenile type 1 diabetic. She is non-compliant. She checks her sugar when she feels like it. And when she does check her sugar, she doesn't properly clean her finger with an alcohol pad. She doesn't change the lancet. She carries MRSA. She's just a hot mess when it comes to this disease. She doesn't think it's serious.
Does she intellectually know the risk factors, the risk level that she's at with this disease?
She knows the risk levels, but she has said to me on more times than I can even count that she'd rather have had cancer and die than to live with diabetes. I hate to say suck it up, but you can live with this. It just takes some responsibility to monitor it. But once she turned 13, I had no control of her anymore. She went out of control, her diabetes went out of control, and then the monster appeared.
Well, is it possible that you being, I just have to say kind of a helicopter mom in those early years and being so vigilant and so diligent in making sure that she was compliant, that you became her cue for coping, her cue for doing these things, and then when she rebels a little and is left to her own devices, that she doesn't have the skills. She arrested her development at that early age, because right now she's behaving like an adolescent. She's behaving like a 10, 11, 12-year-old child.
Exactly. Now, I don't think I was a helicopter mom because I was always busy. I worked. She refused to listen to all the doctors. I have taken her to the best doctors, the best.
But you did an awful lot for her.
For the first 5, 6 years while she was still, 7, 8, 9, 10, 11.
Why is she not complying?
Because she wants to be like everybody else. She wants to eat what she wants to eat. She does not want to have to take shots. The fact that she can't feel her feet, the fact that she has got horrible ulcers and scars all over her legs, the fact that we were just in the emergency room last night, the night before, she doesn't realize that this is going to kill her.